Alrighty, we're working with Tiffany today. She's got a bit of a headache going on. She is our front desk receptionist, so she is on the computer a lot. So for those of, well, all of us that spend a lot of time on devices, these are some of the things that we can do to help relieve some of the aches and pains associated with headaches. So she's telling me that it's a lot of, she had some migraine symptoms yesterday. It started with an aura, and that it is kind of around from the edges of her eyebrows across the front of her forehead and down a little bit the nose. So what I'll actually start with is working on the suboccipitals, which are underneath the base of your skull. And we just try and get her to relax, right? Let her relax under my fingers. Okay, a little tender through there. Mm-hmm. Right, so it's a little tender. And then I just use my body weight to sit back. So we get a little bit of a chin tuck on her because we do spend just too much time in that head jutted forward position. Suboccipitals are fine motor muscles, so they tend to be very active and are somewhat resilient in terms of, or temperamental at least, in terms of releasing over time. As it stands right now, maybe I feel the right side relaxing a little bit and we're getting a little bit on the left side. I may have to adjust my fingers a few times throughout this process just to feel like I am able to hit everything that I need to. Typically, we would turn the lights off during this treatment, but if we're recording, we don't have enough natural light in here to show you what I'm doing. And having both a face mask and an eye mask may be just a little too stifling for the patient. All right. How are those spots doing, Tiffany?
Good.
Okay, feel a little better?
Yeah.
Yeah. All right. So I'm going to move on to the next spots. Worse on the right side? Worse on? Okay. So I've just adjusted my fingers a little bit. I'm still on the base of the skull, but I've moved out towards her ears a little more. I'm just using my body to lean back. I don't have to curl my fingers into her skull to get these to relax. It just takes a little bit of time. So she did mention that she used a face mask to help with her migraine yesterday. So that may be where some of the tenderness along the eyebrows and the cheeks may be coming from. But we'll see if we can't follow a similar process as we are on the back here. I can feel the right side pulsing a little bit. That might be my fingertips. The pulsing is decreasing on the right side. How's that right side doing, Tiffany?
Better.
Better.
Mm-hmm.
Okay. All right. Are you a jaw clencher, Tiffany?
Yeah.
Yes, she's a clencher. Tender through the sides here. Mm-hmm. Okay. Tender on the jaw.
Mm-hmm.
All right. She's a little tender on the jaw. So for you folks who are grinders in your sleep, you need a mouth guard. This is, or any sort of TMJ or TMD issues, your physical therapist can help you with that. A lot of the issues associated with the temporomandibular joint is associated with your posture or neck. So we're all connected. So sometimes I can feel the release on some folks. Tiffany is quite skinny, so it makes these things easy to find. Makes my job very easy. And I do feel that slow spread of relaxation. And I just got it in her right side, I feel. Mm-hmm. I feel a little easier. Mm-hmm. All right. So we're going to come up through essentially the sinus area and then both the frontal and the maxillary sinus and apply some of these similar principles. Still tender through there? Mm-hmm. Okay. So all I'm going to do, I'm going to apply less pressure And we're just going to stretch the skin. I just feel like gentle pressure. Is that still pretty tender?
No, just normal.
Okay, it feels normal. How's the tenderness on the left side?
Good.
Okay. Has the right side improved, or is it okay? So right side's better. So if we come right to the tip of the eyebrows, still tender. Is that okay? Still a little tender. So again, I'm just going to little skin release. Is that mostly pressure? Or is that tender? That feels good. She says. Does that feel through there?
Fantastic.
Fantastic. All right, so the last spot we got is the area around the maxillary sinuses. And then we'll reassess how our headache's doing, see if we have to do some further work. The hands-on is just a portion of the treatments associated with headaches, whether they be chronic or just acute. There is an exercise background to it, trying to be more upright in our daily life, as well as limiting screen time. There's a dietary component, there's a sleep component. All those are factors in how we manage headaches and just our general life. So this is not an all-inclusive treatment, but it could be a start for you if you have headache issues or TMJ issues, and you're wondering what physical therapy can do for you. Okay. There's one cheekbone. All right. A little tender. All righty. A little worse on the right than the left. All right. Again, she's skinny and she's well hydrated, so it helps me to feel these things a little more easily. I feel like her left side has relaxed very quickly, whereas her right side is being a little temperamental. Did that right side ease up?
Mm-hmm.
All right, right side's feeling a little better. I've got 2 more spots. This one I learned from Great Lakes seminars. I believe it was Stuart Orr. He taught a great class regarding advances in exercise as a physical therapist. I probably butchered the title of the course, but Stuart, thanks a lot for this one. All right. Okay. Tender through there or pressure? Okay. A little worse as we come up.
Mm-hmm.
It's tender all the way up. So, she's squinting a little more. So because we spend so much time in this head forward posture, these muscles on the front tend to get underused as the back is just hanging on for dear life. So if we can just help everything move a little bit better, this can be a start. And again, with Tiff, I can feel everything on her. Makes my job really easy. And I'm also looking at her eyes, especially that as her eyes start to squint a little less, as it becomes a little less tender. That's also a clue for me. That a little easier than it was, or not quite. Still a little tender, or not too bad. It's okay. And then that's okay down there.
Mm-hmm.
All right. So we only do one side at a time, because otherwise we're choking the patient, or it feels like we're choking the patient. All right, not too bad. Not too bad. Okay. Not tender at all, mostly pressure. All righty, so that's it. Like I said, this is only part of the treatment that we would do for headaches and or even jaw type issues, but how's your headache doing? Good. All right. Once she it felt good. Once she sits up, and a little bit right. She's been laying down for a little bit. She's nice and relaxed, but we'll let her sit up, kind of move around, see how she's doing, and maybe we'll do a little follow up. Our upload schedule is quite booked right now, so this is the Friday before Memorial Day. So if you're seeing this, I hope you've had a good Memorial Day. I hope you've stayed safe, and all the best to you and your family from C-Bay. Stay safe, folks. Alrighty, so Tiffany is feeling a little bit better in terms of her headache symptoms. So what we're just finishing out is with a little bit of a hot pack across the face. I've got a couple layers of towels down just because it is a more sensitive area. So we're just gonna let her relax for a few minutes. She and I have talked about that. Maybe we do limit some of her screen time, or that she does try and get some better rest. As we've been dealing with this crisis, we've all been dealing with our own anxieties and some difficulty sleeping. So knowing that, from my side, knowing that we do have to deal with these things, at least what we can do is know how to make ourselves more comfortable as a thing that we can't control. I can't control this pandemic any more than you can, but I can control at least how I can live through it. Stay safe, folks. Call us if you have any questions. Call your mom, call your friends, talk. See what you can do to help yourselves in this troublesome time. But we're here for you when you need it. Stay safe. Happy Memorial Day.